Hi, in this video we will be seeing growth and development of an infant. I have already told you in the previous video on growth and development of toddler that it is always easy to understand growth and development of toddler, and it will help you understand other age groups growth and development in a better way. So please go through the video on growth and development of toddler before coming through this video. So infant is the age group from 0 to 1 year of age group. Let's move on with the growth and development. For easier understanding, I have classified the age group into 3 to 4 months, 6 to 7 months, 10 to 11 months and 11 to 12 months. Some of the features shown by the child is similar in certain months, so I have given in this way. We will be starting with the vital signs. There is no formula for finding the vital signs in this age group, so you have to learn it. The temperature is same for all age groups. So temperature is 36.5 to 37.5 degrees Celsius. The pulse rate, it is slightly increased in 3 to 4 months and it reduces as the child ages. So from 90 to 150, it is moving to 80 to 140 beats per minute. The respiration is 25 to 40 breaths per minute in 3 to 4 months. Later on it gets reduced to 20 to 30 breaths per minute. The BP is same in this 1 year of age group, that is systolic 75 to 100 and diastolic 50 to 70 mm of Hg. Moving on. Anthropometric measurement. From birth till 10 months, you will be seeing just 4 things in anthropometric measurement: weight, height, head circumference and chest circumference. There is no need of measuring mid-arm circumference till 10 months. There is no importance. But after 10 months, you can assess the mid-arm circumference also. And at 1 year of age, the feature which is seen as head circumference becomes equal to the chest circumference. So this is the important point in anthropometric measurement. There are some formulas also. So 3 to 12 month all child weight can be found out by the formula age in months plus 9 divided by 2. Formula once again, you will be getting the formula in kilogram, the weight in kilogram. The weight for a child from 3 to 12 months is age in months plus 9 divided by 2. The birth weight becomes double by 5 months. The birth weight triples by 1 year. The birth weight quadruples by 2 years. This is also very important for you to understand. You need to ask the parent what is the birth weight, and at 5 months whether it has doubled you can check. By 1 year whether it has tripled you can check, and by 2 years it will be 4 times. And height also has got some important features. At birth it is in the range of 50 centimeter, and at 1 year a 25 centimeter more increase you can see in the height, so it becomes 75 centimeter, and height is doubled by 4 years. This is how you need to measure the mid-arm circumference. The hand should not be lying down. We need to flex at the elbows. Then you can see 2 prominent features of the bone when you are touching. One is acromion process and next is olecranon process. So from the acromion to olecranon, you keep one tape measure. You measure from acromion to olecranon, then you can find one midpoint and that tape. So don't take the inch tape from there. There itself you have to rotate the inch tape and find the mid-arm circumference. Hope you understood how to find the mid-arm circumference. You have to flex at the elbows, Then from acromion to olecranon, you have to measure with an inch tape. Don't take the tape away, and at the midpoint you have to rotate the tape and you have to find out the mid-arm circumference. For till 1 year, it should be in the range of 12 to 16 centimeter. The normal range we can tell is if the value is more than 13.5, the child is not malnourished. So here also with this formula you can find out actual weight by expected weight into 100. If you are calculating, you can find out the degree of malnutrition. These are the 2 points you need to keep in mind. Next is sensory development. So there are some changes we are seeing in the child. 3 to 4 month old child will be following a moving object. So take a colored ball in front of a child. A red colored ball will be better. So you will be moving it along the front of the eyes. So you can see the child will be moving the eyes in that particular direction of the ball. That is, it follows a moving object. Good binocular vision is present for the child. That means from the both eyes the child will be able to visualize. They will look for toy that disappears, but just momentarily. They will not be searching, they will be just looking for the toy that disappears. Can focus on small objects. So even a little size decreased things, if we are showing in front of the child, they can focus on that. Stares at rattle placed in hand and take it to the mouth. So they will be staring at the rattle, and also whatever things we are giving in hand, the child will be taking to the mouth. So that is a sensory development. Recognizes familiar objects like feeding bottle, toys, clothes, etc. So they are able to recognize the things which are familiar to them. Beginning hand-eye coordination. Everything which we will give to the child's hand, they will be taking to the mouth. And also there is a good hand-eye coordination. Hand-eye coordination in the sense they can see and they will be showing their hands to reach it out. They comfort self by sucking thumb or pacifier. When you are observing a child, you can see that they will be whenever they are alone, they will be taking the thumb or a pacifier if you are keeping, and they will be sucking on that and they will find satisfaction. Then 6 to 7 months, when we are making any sound, head is turning in a curving arch. They will be turning their head. Then depth perception begin to develop. Now fixates on very small objects. Discrimination between simple geometric forms. So a round shape they will be able to understand better than compared to some other square box. Then 10 to 11 months. Show pleasure when desired act is done. We can see a smile on the face when they are catching a toy. They tilt their head backward to see. So this is the time when they will be looking at the back also to see. 11 to 12 months, full binocular vision has come and they will follow fast moving objects. So this is the time when moving toys we will be providing to a child and they can follow the fast moving objects. They will be seeing through the eyes. Discriminates square, circle and cube on base of color and shape. So earlier it's the 6 to 7 months I told you they have started discrimination between simple geometric forms. So how you can understand this is if you are placing one ball, round ball and one square box. So at that time if you are telling the child to take a ball, now they will be touching the ball. So that shows they are able to discriminate. Dentition. 3 to 4 months, no teeth. 6 to 7 months, upper and lower central incisors. From 6 to 10 months, you can see that lower central incisor starts coming. Then the upper lateral incisors at 9 to 13 months and lower lateral incisors at 10 to 16 months. So you need to see this picture and understand. So first central incisors will be coming at upper and lower part of the mouth. Okay. Moving on. Language and speech development. 3 to 4 months, they just look in the direction of the speaker. They cry less, may laugh aloud or babbles. Simply some sounds are produced, that is babbling. Then 6 to 7 months shows enjoyment in hearing own vocalization. So this is a time then they will be making so much of sounds and they are enjoying that. Then when we are taking the child to a mirror, they will be making some sounds, that is their talk. 10 to 11 months, they speak one word besides mama and dada, such as no and hi. So 6 to 7 months or 6 to 10 months time, they might have started with monosyllables like mama, dada, things like that. And once a child is reaching 10 to 11 months, some words like no, hi, that words will be coming from the child's mouth. They understand the meaning of bye-bye and they will be showing gestures. 11 to 12 months, they imitate specific sounds of others. Some cat or crow, they will try to imitate that sound. Jargon is well established, that is their own words. They will be starting forming their own words which don't have any meaning for us people. Respond to simple question. They will be mostly saying the answer no at this time. Safety and love need. This is something you need to educate the parents for a child till 1 year of age. Safety and protection from suffocation, the sleep position. The child is not able to uncover themselves. So parents should be very careful about the sleep position, asphyxia, that breathing difficulties, animal bites, falls, electric burns or any other burns, poisoning, ingestion, accidents and drowning. Mostly till 1 year, it is others who create problem for the child. It can be an elder sibling or it can be someone who is not taking care of the child very nicely. So from them accidents can happen. So we need to educate parents on that. Love and security must be provided to the child through warmth, support of the head and neck, and preventing separation anxiety. Encourage inquisitive behavior in the child. You can hide something and show. You can play with the child peekaboo. So all these things will encourage inquisitive behavior in the child. Develop sensory perception. Provide play materials in the way that it will enhance the development of all sense organs. Soft toys for touching, then for bright things, if you are providing, that is good for the eyes. Some noise producing musical instruments, if you are providing, that is for the ears. So like that, you have to develop the sensory perception of the child. This thing you need to teach the parents. Avoid unpleasant taste and avoid painful experience, because later on also the child may dislike the thing. Personal hygiene, how to bathe the child, how to take care of the eye, skin care, appropriate clothing for the child, you need to tell. care of milk teeth and permanent teeth. Even though initially in the initial months teeth has not come, you can teach the parents how to take care of the primary teeth. Regular medical checkup and immunization. So this is about the safety and love need which you need to educate the parents. Nutrition and sleep need. Another important point you need to educate the parents is regarding the nutrition and sleep of the child. The food in the initial till 6 months it's breast milk, and after that weaning food you will be starting according to the culture. Then calorie, protein, iron requirement, calcium requirement, all these things are increasing. The water requirement is 110 to 130 ml per kg per day for this till 1 year of age. And the sleep, the child requires a sleep of 12 to 14 hours per day. Play need. They may be enjoying solitary play, independent play, and social affect play. That is, they like the company of other people also. They will be playing alone, but they will be enjoying if others are also there. Gross motor development. They hold hand predominantly open. So their hands will be most of the time open. They bring hand together in midline. They bring hand together in midline. You can see in this picture. Plays with fingers. They will grasp objects held near hand, but once that object is dropped, they are not able to pick it up. They will be grasping the object if we are giving something in the hand, but if it is dropped, they are not able to pick it up. Then sometimes with both hands they will be trying to grasp the object. Not sometimes, most of the times. An attempt to reach object with hands will occur, but they will not be able to correctly touch that object. That is what they overshoot them. Objects are carried to the mouth, and thumb opposition in grasping occurs between 3rd and 4th month. Thumb opposition, so it is opposing the other fingers. That feature starts in 3 to 4 months, and the child will be clutching the clothes. So this is the gross motor development of a 3 to 4 month old child. Here another point I need to tell, the fine motor development is also same for 3 to 4 month old child. The fine and gross motor development of 3 to 4 month old are same. There is no special difference. So fine motor development I have not given separately. 6 to 7 months, the child starts to sit alone on hard surface, leaning forward on hands. So they will be placing 2 hands in front like a frog or like an elephant, you can say. So, and they will be leaning forward, they will be sitting alone. They lift head as if trying to sit up when supine. So when they are in the supine position, they will try to sit up by lifting the head. Control of trunk is more advanced. That entire body control is little more advanced in the child. They rolls more easily from back to stomach. So at this time this is their play, rolling from back to stomach. So you should be very careful of a fall from bed. They should be kept at the middle of the bed or on the floor, otherwise they will be falling from height. Sustains all body weight when standing. They are able to hold on most of their body weight when they are standing, but we should give a support. Bounces actively when held in standing position. When we are making the child to stand, they will be bouncing very actively. So this you can try with the child of 6 to 7 months. Then 10 to 11 months, They stand erect with minimal support and lift one foot to take a step. They stand erect with minimal support at 10 to 11 months. Then they cruises, that means they walks holding on to a furniture. So a walker you can provide at this time so that they can push and walk and they can run around the house. 11 to 12 months, they stand alone for long time. They sit down from standing position alone. So this is a feature which is seen in 11 to 12 months. They sit down from standing position alone. It is not a fall. Walks in few steps with alone or with help. They try to walk in few steps with alone or with the help of others. Fine motor development. Already I have told 3 to 4 months the gross motor and fine motor development are same. 6 to 7 months approaches a toy and grasp it with one hand. So they will be reaching out for a toy and they will be grasping it with one hand. They can hold separate toys in each hand. If you are giving two toys in each hand, they will be holding it. Till 6 months, one thing you can observe in a child is, if you are giving two toys to the child, one toy the child will be dropping and the other one the child will be taking. So here separate toys in each hand you can make them hold. They transfer object from one hand to another successfully. They are able to transfer small toys. They imitate simple acts of others. So in front of the child, if we are showing clapping, they also will try to imitate. Bang object that are held. If two toys you are giving, you can see both of the toys, they will be bringing close to each other. They are banging and making sound. They can hold a cup. Don't give water in that. They will be just able to hold a cup. Uses a raking grasp to try getting small objects. Raking grasp means they are trying to use the entire palm to grasp the thing. 10 to 11 months, they explore toys and objects more carefully. They will be taking the objects and they will be exploring it carefully. They remove cover from boxes, then takes toy out of the box or cup. They begin to hold crayon and make a mark on the paper. So in a paper, if you are giving a crayon also, simply some marks you can see. 11 to 12 months, the child has got good pincer grasp. Here I would like to tell an example from my life. When my child was 11 months old, she saw one millipede going through the side. So this is the age in which gross motor development is. The child will be able to creep and crawl. So she crept and crawled and went to that millipede. This is the time of pincer grasp. The child with the fingers is able to take the things up. And third feature is taking everything to the mouth. So that activity also the child will be showing, and my child has shown. Thank God nothing happened. So that is just an example how all these things they are doing. Picks up small bits of food and transfer them to mouth. Enjoy eating with finger. They attempt to put small pellet into a narrow-necked bottle but does not succeed. So this is an activity you can do it in the hospital. Small bottles, a Pepsi can or a small bottle you can take, and some paper balls you can make, and you can ask the child to put the paper balls in the bottle. So mostly they won't be able to do this at a time, but they will be able to pick up that paper balls with fingers. An attempt to put one block on top of another. but does not succeed. Blocks you can give, but they won't be successful in keeping it. Turns pages of a book, but not one at a time. Maybe 10 pages at a time they will be, or the entire book they will be closing. So like that, when you're giving a book, they will be turning. Drink from cup and eats from a spoon, but they need help. They can hold crayon and they can mark on paper. They will cooperate in dressing, like putting arms through sleeves and feet into shoes. They will be cooperating with us. So this is their fine motor development. Psychosocial or emotional development, the stage in 1 year of age is sense of trust versus mistrust. That means, according to Erik Erikson, if the sense of trust is not developed at this age, later on it can result in mistrust as a human being. The child won't be able to trust anybody in the future. So 3 to 4 months, the trust. The child smiles in response to smile of others, or when the familiar person appears. The child smiles. Initiate social play by smiling or vocalizing some sounds they will be producing. That is a social play. Sense of trust in 6 to 7 months. They show increasing fear of strangers and they will cling to familiar person. In the hospital you can see the caregiver, the mother or the father, only the child will be clinging. Seeing the nurse, they will be crying. There is a fear of stranger. You need to understand the stranger anxiety at this stage. So whenever you are approaching an infant, 6 to 7 months, you need to go and make a good relation with the parents. So and don't mind the child. Once the child understand this person won't harm and they are in good relation with the parents, later on they will come to you. This is how you have to approach an infant. 10 to 11 months, they show pleasure when a desired act is accomplished. When some toys they have received, they will be showing pleasure. Or when the mother has gone somewhere outside and come back, they show pleasure. 11 to 12 months, they become frustrated when activities are restricted by someone. And they always seek for approval from the parents. Parents, yes, no, they like. And they avoid disapproval. Next stage is psychosexual development given by Sigmund Freud. So the first stage is oral stage, 0 to 1 year. Oral stage means everything the child is taking to the mouth. Oral aggressiveness is evidenced by biting and chewing. Here you can see in this picture, pincer grasp you can see, and the child is able to sit without any support, you can see. So oral stage is psychosexual development. Moral development given by Kohlberg, it is pre-conventional morality, that is egocentric. They want to get whatever they like. They will be crying otherwise. So that is pre-conventional morality. Cognitive or intellectual development given by Jean Piaget. The main stage we will be calling is sensory motor stage, and it has got different sub-stages. The first stage in 3 to 4 months is known as primary circular reaction. 4 to 8 months it is known as secondary circular reaction, and from 8 to 12 months it is known as coordination of secondary schemas. So we will see what each one is. Primary circular reaction means they begin to repeat actions of own body voluntarily. Means they will be taking the hand to the mouth and they will be sucking on the hand. So that is a pleasure thing for them. They will be repeating this action. This is primary circular reaction. Second, secondary circular reaction, 6 to 7 month old child, that is the range is 4 to 8 months. You can see this. The child will be intentionally repeating an action to elicit response. The child will be intentionally repeating an action to elicit response. Intentionally repeating, you can see banging a toy. A rattle if you are giving, they will be trying to make sound again and again. So that is intentional repeating an action. Secondary circular reaction. The third stage of their cognitive development, this shows their intelligence. The third stage is coordination of secondary schemas from 8 to 12 months. So infant will be pushing one toy away to reach the next toy. So they know that they have to push the one thing aside to reach the next. So that is coordination is happening now. Intentional actions you can see, and they will be having object permanence. They understand an object exists even when it is out of sight. In a small child, a 3 to 4 month old child, even if you are hiding the thing, the child will not search for the thing. But at this 8 to 12 months when you are hiding, the child will be searching for the hidden object. Last is spiritual development, which is given by Fowler. So there is no such spiritual development, so it is known as undifferentiated. Here we have to develop the feeling of trust, warmth, love and security, so that later on faith will be developed through trust. So this is undifferentiated. This is all about the growth and development of an infant. Hope in this way you will be able to assess the growth and development in the bedside of a child. Thank you so much, and do subscribe to this channel.